For those that weren't with us earlier, I do want to offer another reading of her bio just so we understand who Dr. Flagg is and how she comes to this space. She has over 25 years of experience in health policy development and advocacy. She has worked with numerous organizations, including the California Association of Public Hospitals, the Centers for Medicaid and Medicaid Services, also known as CMS, and the United States Department of Health and Human Services in the US DHS. And she's also worked with Kaiser Permanente. Additionally, Dr. Flagg was the Director of Health Policy at the California Medical Association, or CMA. Dr. Flagg's research interests include state policy making and healthcare politics with a focus on Medicaid expansion. Dr. Flagg is a lecturer at the UC Berkeley School of Public Health and San Francisco State. She received both her MPH in Health Policy and Administration and her PhD in Health Services and Policy Analysis from UC Berkeley. Her BA is in Art History from Williams College. Following her BA, she worked for 3 years with the US Peace Corps in Nepal. Welcome, Dr. Flagg.
Hi, everybody, and here we go again. For those who've been with me before, as you know, I speak very quickly, so I do urge you to ask questions either directly or through chat. I prefer questions along the way because then it's completely relevant to what we're doing and no one forgets. So let me share screen. So my earlier conversation, I gave you an outline of our quote unquote healthcare system and made a couple of points that I wanted to share. One that I want to highlight again, because it's completely relevant for today, this lecture, is about how divided our country is on the role of the federal government vis-a-vis providing healthcare. So I want you to just remember the lessons from that earlier talk where one party, the Republican Party, which tends to be more the party of business, but it's really the party of small government. They believe, many Republicans believe that we should reduce taxes and let people keep their own money and make their own decisions. Whereas Democrats tend to be much more, if you will, paternalistic. They tend to believe that we should make greater taxes and that because the reason we need more taxes is so that government could provide more services, whether it's infrastructure, whether it's education, whether it's healthcare. And I also mentioned it earlier that our country is very divided. So this talk now, I guess after me, you learned more about the ACA and what the ACA offers. What I'm going to talk a little bit more is the politics, which is really talking about those who believe that healthcare should be a commodity bought and sold and not delivered by the government versus those who believe that the government has a role, and the tensions that those two groups of people, huge groups of people, very divided country, believe what has happened since the ACA passed. So you learn that the ACA passed, you learn what was in it. I kind of gave you a really high level, one slide per area. And I know you just had some more in-depth introduction to the ACA. But what I'm going to talk about is the politics of what happened and what happened after the ACA was introduced. So just a reminder at a very high level, and many of you, this may have been a long time ago, and some of you I know may not have not grown up in the United States, so this may be new, but I just want to remind us all that the Constitution establishes 3 separate but equal branches of government. They set it up so there are checks and balances. We have the legislative branch, which is charged with making laws. Then we have the executive branch, which is charged with implementing laws and running the government. And then we have the judicial branch, which is checked with making sure that the laws that were introduced don't compromise the Constitution, and they ensure that people's rights are compromised. They also look at the executive branch, which is charged with writing the regulation to implement the legislation. They want to make sure the judicial branch makes sure that the executive branch doesn't implement things that weren't in the law. The executive branch cannot make law, only implements law. But one of the ways they implement law is figuring out the details and fleshing it out. And in doing that, they may go beyond the scope of the law. And that's where the judicial branch will come and say, wait a minute, these regulations are not consistent with the law. So for example, there's a lot of examples, but so the medical loss ratio we talked about in my earlier talk, the legislative branch said it should be 85% medical loss ratio in the business and the Medicare world, and 80% medical loss ratio in the self-purchase. The executive branch now has to implement that. And one of the things they have to figure out is, how do you calculate the medical loss ratio? What counts as healthcare? What counts as administrative? And so they write the regulations implementing that. But they can't say, oh, and so that, let's say 85% medical loss ratio means there's 15% left for admin and profit. They don't have the right to say, and 10% goes to admin and 5% goes to profit, because that was not in the law. They can't go further than the law says. And the judicial branch is sort of the one that's overseeing that. Also, so lots of times it's advocates sue the legislative branch or sue the executive branch because they don't think they're doing the right thing. And then the judicial branch becomes the referee. So I just want to remind that. But there's also the media that plays a role, that educates the public, and their votes matter, votes matter. Actually, Kelly, can you remind me what time I have to?
Anywhere between 7:30 and 8.
Okay, just wanted to make sure. So there's also the media, and there's interest groups that play a role in all of this. So that was just a reminder. I also we're going to get into current events and politics, and I love this stuff. And I know for a lot of you, you love it and you know it. And this is going to be review. And for other views, you can't stand it. And it's going to be a lot of details you don't want to hear, but hopefully you're in the middle and you'll get something out of it. You need 51 votes to pass the Senate, to pass a bill in the Senate. If I asked this question in a poll or in this chat, if I had taken the time and asked the questions, a number of you would have put 60 down. How many votes does it take to pass a bill in the Senate? A lot of people will say 60. Really, the answer is 51, a simple majority. But because the Senate has a procedure, it's a rule that the Senate makes for itself. They have something called a filibuster, which means one senator can just say, my turn to speak. They get up and speak, and they can speak forever and ever on anything. And when I was a kid, they literally would stand up and read the phone book. That's called filibustering. They're basically taking over the floor and not letting the Senate go on with the vote. So you need 51 votes to pass a bill, but you need 60 votes to tell the person filibustering to shut up. That's called cloture. So nowadays, because our country, the Democrats don't like the Republicans and vice versa, and everybody thinks the other's the worst thing since the worst thing in the world, every bill is filibustered. And so you do need 60 votes to pass a bill, because every vote in every single bill that is of any substance at all is filibustered. A couple of comments on that. Nowadays, they've made filibustering easier, which is why every bill is filibustered. When years ago, and not even that long ago, I don't know when it changed, but I'm guessing the 80s and 90s, you actually had to take your turn when it came to speak, stand up and speak, and never sit down. And you used to have to speak to something that was relevant to the bill. So a famous case of filibustering did not happen in the Senate, in the DC, but happened in Texas. Wendy Davis filibustered a bill that would have made abortions illegal in Texas, or made it even more constrained and harder to get. And she knew that the Senate was going to close in Texas, was going to close at midnight for the rest of the year. She got the floor, I don't know, 7, 8, 6, early in the day. Early in the day, she got the floor, and she spoke about abortions till midnight. She actually had a catheter put in so she didn't have to go to the restroom. She couldn't give up the floor. She had to speak about abortions nonstop, and she couldn't sit down. And she did that. They decided, as more and more of our senators became old white men, I guess the fact that they were white and men is not really relevant, but the fact that they were old was relevant. More of them didn't want to speak forever, and they couldn't speak to one topic forever. So they actually made it easier to filibuster. You don't even have to wait your turn. You don't even have to stand up and speak. All you have to do is send an email to the president of the Senate saying, I'm going to filibuster this, and you're filibustered it. So nowadays, it takes 60 votes for anything to pass the Senate, because the minority party with fewer than 51 votes will filibuster. This is all germane, everything I just said, in terms of now you can just say you're filibustering and so forth, because a big debate, not what I'm talking about with the ACA implementation, but happening right now about DC is there is a bill about changing voter rights. And the question is, are they going to get rid of the filibuster? And they need 51 votes to get rid of the filibuster. But one of the Democrats, Manchin, doesn't want to get rid of the filibuster, but he's willing to say that we should go back to the old rules that say you actually have to speak to the topic and stand up and speak, so that it's not as easy to just say, I want a filibuster. But anyway, nowadays, any bill to pass the Senate needs 60 votes. Now, they were worried that if that's the case, that every bill passing the Senate needs 60 votes, they were worried they would never get a budget through. And if you don't get a budget through, the government closes down because you can't function without money. And so the senators made a rule for themselves to follow, saying you cannot filibuster a budget rule. You cannot filibuster a bill that's about the budget. So that's called reconciliation. You can't, if you say this is a budget bill, it's about money, we're going to put it through reconciliation, that means it cannot be filibustered, and therefore you only need 51 votes. Now, there is a person who works for the Senate, not an elected official. The parliamentarian is their name, is what they are called. And the parliamentarian will review a bill and decide if it's just about money, just about the budget, and does it qualify for the reconciliation process or not. And if it qualifies for the reconciliation process, it cannot be filibustered, and therefore it only can have 51 votes. All right, that's enough background for a little bit. All of that will be coming in shortly again. So let me just talk about the ACA and how it was set up to pass and become law. So a reminder, when the ACA was up as a bill in 2009, Obama had won election in 2008, took office in 2009, and guess what? He had 60 Democrat Republicans, and he had a majority in the House. In other words, the Democrats not only owned the House and the Senate and the White House, but they really owned the Senate. They had 60 votes, which meant they could, let me move this, hold up. They had 60 votes, which meant they didn't have to worry about a filibuster. As long as they could hold all the Democrats together, they could get through, and the Republicans couldn't even filibuster, because anytime a Republican said, I want a filibuster, the 60 Democrats would say, shut up, you can't. All right, so the ACA is a product of many different bills that comes in. So basically, Obama says he wants to pass healthcare reform. He gives some overall ideas of what he's interested in, but he left the details to the House and the Senate. And he did this because he learned from Clinton's experience that Clinton gave the senators the details and they got pissed. The senators are elected officials. They didn't want to be told what to do. So Obama didn't do that. Instead, he asked the leader of the House, Pelosi, and the leader of the Senate, Reid, to assign healthcare reform to their committees. So in the House, healthcare reform was assigned to 3 committees: Energy and Commerce, Ways and Means, Education. And in the Senate, it was assigned to Finance and Health, Education, Labor, and Pensions. Now, Ways and Means is the equivalent of Finance. It's the Budget Committee. So the senators and the representatives spent a lot of time, spent all of 2009 coming up with proposals. And in July, 3 committees in the House passed a bill. OMG, this was a big deal. And in the Senate, 1 committee passed. Now, I need to talk about this committee. This committee was chaired, the Health, Education, Labor, and Pension Committee was chaired by Ted Kennedy, who got a brain tumor and died. He, over the decades that he was a senator, every year introduced a bill that was pretty much a single-payer bill. And so he died. Christopher Dodds took over the chairmanship of this bill, of the committee. the Democrats, Kennedy, before he died, appointed Martha Connolly to take over his position until the end of the year. So it was a Democratic senator who was representing Ted Kennedy's, the state of Massachusetts, actually. And they all passed Kennedy's previously approved bill on single payer as a tribute to Kennedy. In other words, the bill that came out of the Health Committee was not going anywhere. It was meant as a tribute to Kennedy. It was single payer. Everybody knew that the bill that came out of the Finance Committee, because the Finance Committee, which is one of the most powerful committees, is the most powerful committee, was actually equally divided between Republicans and Democrats. So the idea is that anything that comes out of that committee is probably the one that was going to become law, because it meant that it had bipartisan support. So we get to the end of the summer, and 4 out of 5 committees pass a bill. People go home for the summer. They're going to 4th of July parties, although it's a little bit late. That's after the 4th of July, but they're having town hall meetings. They're meeting with their the electorate, their voters, and they are being attacked. They are being attacked with rotten tomatoes and eggs. I'm not exaggerating. They are showing up at town hall meetings and people are holding signs saying, "Dump government off my Medicare," which, now that you know what Medicare is a joke, because Medicare is run by the government. But the Tea Party organized all over the country to really attack all of these Democratic elected officials, representatives in particular, but also Senate Finance Committee members, saying, "You cannot pass the ACA." And they started saying things like, the ACA has death panels. The ACA, it offers care to immigrants. It's going to cost a lot of money. They were passing around laws, and it scared people. And it didn't, and actually, for those of us who are following this like a movie, like, oh my God, we're going to get healthcare reform. This is the story. First, it passes 2 houses, the Ways and Means and Help. And then it passed another, and then it passed 2 more. And we're all excited. And everybody's going home. And we think we are going to have healthcare reform. And then everybody's attacked. And it looked like the news swung. And all these people who had voted for healthcare reform are now scared. So come September, they all come back. Obama does a fantastic speech, one of the best speeches ever. I actually play it in my class when I have more time. And he basically yells at the Republicans and says, "Do not lie to people." And then he tells everybody else, this is our last chance. We need to do healthcare reform. He talks about Ted Kennedy, and it's an incredible speech. And he resurrects the debate. Basically, people are now calming down. He tells the country there are no death panels. The death panel was, they were trying to put a change into Medicare where they would pay doctors for a doctor visit to discuss end of life options with their clients, with their patients, so that they could get paid to have the discussion. And the Republicans called this a death panel. There was also something else they called a death panel, but anyway, they were just trying to kill it. So in September, Obama gives this fabulous speech and he resurrects healthcare reform, and the Finance Committee passes a bill. Now, I had said the Finance Committee was bipartisan. You needed 1 Republican vote to pass. Also, you will read everywhere that not a single Republican voted for healthcare reform. That is actually not true. In the Finance Committee, it is true on the floor, but not in committee. In the Finance Committee, Olympia Snowe or Olympia Dukakis? Olympia Snowe, one of them's an actress and one of them's a senator, voted to pass the Finance Committee legislation out of committee and onto the floor. She knew that was the death of her career. She would never be a senator again. She knew that by passing this bill, the Republicans would attack her on the right and put someone in to take her job. She was a senator in Maine. And so right after she passed the bill, she said she was not going to run for re-election. But she did it because she felt it was the right thing, but she knew it was the end of her career as a senator. So now the 3 bills come out of the House, and in October, they combined it into one. 2 bills come out of the Senate and they get combined into one, and they have 60 votes, so they can go to regular process. And Pelosi says, we're going to do this really quick. We're going to have one day for debates and then we're going to pass. And they debated it. And on November 7th, they passed it. They came out of the Senate, went through they had an unlimited floor debate because they don't have time limits in the Senate. It was filibustered. Of course, a Republican tried to filibuster, but they had 60 votes and they told the Republican to sit down and they were able to vote to pass the bill. And so it went to the full Senate. And I want to back up here. I don't know if it doesn't have the dates, but actually it passed the House. I think it was passed the House on December 24th at like 10 p.m. So these were like, we were watching this. It was pretty exciting. Anyway, a bill passed the House, a bill passed the Senate, but they're not the same bill. So they have to go to a conference committee so that the differences could be ironed out. So it is now December, and the country, those of us who are watching this are like blown away that, oh my God, we're going to have healthcare reform. Yes, there's two bills that passed, but they're not that different. They're different in some ways, but they're not hugely different. And so we're going to get a conference committee together, and the conference committee is going to come up with a combined report. It's got to go back to the House to get voted on. They can only do a limited revote, and then they'll vote on this single bill that comes out. They'll pass it, and it will go to the Senate, and it gets an unlimited vote, but it can be filibustered, but they have 60 votes, and they're both going to pass the same bill, and then it's going to go to the president, and we know Obama's going to pass it. OMG, it is Christmas time in this country. We are going to get healthcare reform. Well, around this time, just right after Christmas, there was a bomb scare in Detroit. Some guy was on an airplane and started fumbling with his shoes to blow up the airplane. A passenger next to him saw him doing something funny and jumped on him, and it turned out that there was a bomb scare. There was terrorism was coming back to the United States, and it looked like that they were able. This is why we all have to take our shoes off now, because there was a shoe bomb, and it happened in December of 2009. Well, what else happened in December of 2009 is Martha Connolly, who had taken over Ted Kennedy's seat, was appointed the position to finish out his term. There was a special election in in Massachusetts to see if she can keep the seat on her own. Well, no one really thought about this election. Obama would say it was one of the biggest mistakes of his career, of his presidency, is they didn't worry about it. It was Ted Kennedy's seat. Ted Kennedy, and before that, it was another Kennedy's own Massachusetts. It was a Democratic state. They were Democratic senators. The Democrat was going to win, and they didn't pay attention. The shoe bomber happened. The Democrat wasn't a very organized, wasn't very charismatic. I have friends who are Democrats in Massachusetts, and they didn't vote for her. And actually, we went to school with her, and a friend of mine who went to school with her didn't vote for her. But Scott Brown was running against her, and he was an ex-Marine, and he campaigned on safety. And then this shoe bomber went off, and everybody assumed that Ted Kennedy's seat was going to a Democrat. And he said, look, that's not Ted Kennedy's seat. This is the state of Massachusetts seat. And he won the election. Those of us following this thought healthcare reform was dead, because now they can't get it through 60 votes. They only have 59. But they can't go through reconciliation if it's a policy issue. It can only go through reconciliation if it's a budget. Well, it turns out that many of the differences in the conference report between the two bills were actually budget issues. For example, how much is the penalty if you don't have insurance? For example, how much subsidy are you going to get? Now, there were other issues that were different, but they had already passed. So what they decided to do is the issues that were different, that weren't budget, they would take the bill that already came out of the Senate, and the House would have to pass that. But that the Senate could change some of the money issues through reconciliation. So it wasn't as clean as they had hoped. It wasn't as big of a majority as it hoped. The House was forced to accept the Senate's bill. So this didn't come out as clean as they wanted, because they lost their filibuster-proof voting, but it went through. Now, I just want to remind you, politics is about differences in ideology. The main continuum of what we talk about in politics is the role of government. This is what I said before. So really, healthcare politics between the Republicans and Democrats is about what the role of government is. I've already said this. All right, so let's move on. So people were unhappy with healthcare reform. Here's a cartoon. I hate Obamacare. Healthcare reform should be repealed. And she says, which part? The one that ensures children aren't denied care due to a pre-existing condition? And he says, no, I like that. She says, the part that allows kids to be covered by their parents until 26? No, that's good. The part that stops insurance providers from dropping people when they get sick? No, that's great. It's the other part. Which one? The Obama part. Really, this is an example of what the Republicans were fighting. They had just decided that no matter what Obama does, even if they like what Obama does, no matter what Obama does, they're going to vote against it. Obama picked a plan that was written by Republicans for Republicans, thinking that he would get bipartisan support. And they didn't care about any of the policy or anything that it did. All they wanted was to get rid of Obamacare. Now, what did conservatives not like, really? Well, first of all, they don't like increased taxes. They don't like government mandates. They really want to reduce government. They don't want to have a new expansion, a bigger Medicaid expansion and subsidies, these generous subsidies in the ACA is a new entitlement. They also think that states should have their own say. They felt this was too centralized. They felt that it would try to change everything when it really should have just changed, just to do one thing. They felt the individual mandate didn't make sense. And they actually said, which most people would agree, that it didn't focus on costs at all. All it did was put people in the buckets, and it didn't try to clean up the buckets. And this is from a slide that Lam Hee Chen, who is a speaker at Stanford, a fellow at Stanford, put out at a conference I went to. I already talked about the checks and balances. Republicans hated the ACA. They wanted to get rid of it. So what could they do? How could they do it? They could do things in the legislative process. They could repeal the ACA. They could starve it. Don't forget, they have to pass a budget, and the House controls the budget. And if they don't put money into it, then maybe the ACA can't really be implemented. Or they could amend it, or they can go through the executive process. Remember, they can't go through the executive process when a Democrat owns the House. They weren't going to get Obama to undermine his own bill, but when Trump won the White House, they can use the executive process. They could take back the White House, and they could stop implementation, and they can work on the regulations. They could try to undermine the regulatory process, because regulations are open to input, and they worked hard to slow down the regulatory process, to starve the regulatory process by not giving the administration the people they needed, and then they tried to make it difficult. They also could sue. And they could say that the law wasn't constitutional, and they could also sue the regulations. And you know what they did? All the above. So what did they do in the legislative process? Well, during Obama's administration, prior to December 15th, the House, which was now owned by Republicans, they lost the House in 2010. Republican representatives voted 65 times to repeal the ACA. But it was never taken up in the Senate, because the Senate was owned by Democrats, and they weren't going to even vote on it. Harry Reid didn't even bring it up. It never got on the agenda. Well, they lost the Senate in 2016, and they did take it up. The House passed a repeal again, and guess what? This time the Senate said, yes, we're going to repeal it. Now, they didn't have enough to do it through the regular process, so all they could do is starve it completely, just stop all funding through the budget process. So they voted to repeal it. But they knew Obama was going to veto it. This is important to think about. The Republicans agreed to repeal it, knowing it would not be repealed. They voted to repeal, knowing it was not going to be repealed, knowing Obama would veto it. They never came up with an alternative. All they were going to do is repeal it and go back to the prior status quo. All right, we know that Trump got elected in 2016, and in the summer of 27, they tried through the legislative process, the Republican tried 3 different bills to repeal it. Each bill worse than the next. All 3 bills passed. Well, the Better Health Care for All passed the House, but couldn't pass the Senate. Well, why not? They had already voted to repeal it. One more hard try for repeal and replace. Okay, forward in 3, 2. The reason why they didn't repeal it is because they didn't agree on what to do. The reason why they couldn't vote to repeal it is because they were scared. I'm sorry, we did everything we could, but unfortunately, it looks like he's going to make it, and Obamacare survived. And here's the real cartoon I want to show. A voter is talking, by the way, an elephant is a Republican, a Democrat is a donkey. So someone is saying to a Republican, hey, you passed a bill to repeal Obamacare when Obama was president. Why don't you pass it again? And the Republican is sweating and is scared. And he says, because Trump won't veto it. They are willing to vote to repeal Obamacare, so long as it's never repealed. The issue here is Republicans have told their constituents and ran for re-election promising to repeal Obamacare. But they know that if they actually do repeal Obamacare, their constituents will be really angry because their constituents now have health care because of Obamacare. And so they promised to do it, but they really know that if they did it, they'd lose their job because their people don't really want it repealed. They hate Obama, perhaps, but they like their health care. And so this is the real issue that the Republicans had a hard time when they own the House, they own the Senate, they own the White House, and they couldn't repeal it. Why? Because they knew that they couldn't really repeal it. Their people, Republican states, were the states that had the most people in Medicaid, are the states that had the most people in ACA expansion. And they maybe didn't even know that when they finally got health care, it was because of Obamacare. They just know they had health care. And if their elected official voted to repeal it and they lost their health care, they can't blame Obama anymore. He's not even there. They'll blame the Republicans. And so the Republicans were really stuck between a hard place. They had promised to repeal it, but they really didn't want to. They loved it when they could vote to repeal it, but knew that Obama wasn't going to let it happen. But now, oh my God, if they did vote to repeal it, Trump will let it happen, and they did not want that to happen. Interesting, huh? However, they did manage to pass something through a Reconciliation Act, just a couple lines in a budget agreement in February 2018. They passed a law that basically changed the penalty for not having coverage to $0, AKA the mandate, one of the legs of the 3-legged stool, isn't really a mandate anymore. Yes, the law still says they couldn't change the law because that's policy, and they can't change policy in a reconciliation process. But in reconciliation, they changed the penalty to 0, meaning the 3rd leg of the stool, which says you have to have insurance, you still have to have insurance, but if you don't have insurance, there's no punishment. So this is very important, and this is still law of the land, and I will talk about this in a little bit. So that's what they did legislatively. Not so much, except they changed the penalty to 0, and now the question is, can the 3-legged stool survive? All right, take a breath. Any questions about the legislative process and any changes that the Republicans tried to do after the ACA passed till current events? Actually, not till current events, through Trump. Any questions or comments? Nope.
I haven't seen any questions coming yet.
Okay, so we can move on to the executive process. So they couldn't really repeal it legislatively because they didn't really want to. And when they knew they didn't have to worry about it, they did, but they knew Obama wouldn't let it happen. So they really didn't want to, or at least they didn't, let's put it this way. They didn't want to be responsible for getting rid of it. Well, there's the executive branch, which means the White House under Obama has to implement the ACA. And then under the Trump administration, Trump has to administer the ACA. The first thing that Trump did he went immediately from his inauguration to the White House, and he signed an executive order that directed Health and Human Services, which is a branch of the federal government, and all his other agencies to get basically undermine the law, waive, defer, make exceptions, delay implementation, anything they could do to make the ACA flounder, to get rid of it on the executive side. And he said it was to minimize the economic burden of the health law, but really it's to make it die, basically. Trump put out this executive order. Now, this executive order was a signal to the world that he was going to get rid of ACA. It didn't mean anything because he's telling his secretaries at HHS and the IRS and the Labor Department and anybody else that had anything to do with healthcare to do this. But guess what? There wasn't a single secretary yet. They weren't appointed yet. And you can't just get rid of regulations. There's a long process to implement regulations, and you have to go through the same process to get rid of it. But this was a signal. I got text messages and phone calls and emails from students all over the world saying, oh my God, he killed the ACA. No, all he did was signal to the world that he was going to try to get rid of the ACA, but this itself doesn't mean has no power. But he could do a lot, and he worked really hard to undermine the ACA from the inside. And in particular, he changed 3 regulations. I'm not going to go into a lot of details on this. You can ask questions if you want. But basically, they put in some new opportunities under the ACA through regulation that undermine the risk pools of the ACA. And from our earlier talk, you understood the value of a risk pool and making sure it's balanced. What the Trump administration did is pass 3 regulations, one which allowed association health plans, which were exempted from the ACA, allowed that they could do underwriting, they could have very, very narrow benefits networks, and they didn't have to follow the essential benefits. They also, and the reason why this undermined the ACA is who would buy these plans? The healthy, the young. They're going to be so cheap. And people can go and buy this and they don't care that it doesn't cover anything. But that would bring the healthy and the young out of the ACA risk pool and undermine the risk pool and cause a spiral up. They also passed the ACA allowed for short-term plans for people who were in between jobs to buy something short-term, and those short-term plans were exempted from ACA requirements. They were really meant as emergency plans, but Trump changed the term. Under Obama, they were only allowed to be 3 months. Trump's regulation changed them to 1 year and said you can renew them. In other words, you can have them forever. These, like the association health plans, were exempted from ACA. They weren't very good coverage. They could be really cheap, and they attracted the young and the healthy. Again, would undermine the risk pool. And the third thing they did also to undermine the risk pool was to allow that employer-based coverage allows for health savings accounts and gives people pre-tax dollars. This regulation would allow people to use the money in their health savings account to buy health plans, to buy a health plan, which wasn't allowed before. All 3 of these were meant to attract the young and the healthy and get them out of the other risk pool so that it would spiral out. Now, I can tell you immediately, all 3 of these were sued by advocates arguing that regulations cannot expand the law, they can only implement the law, and therefore these were not legal because they went beyond the law. They changed what the law allowed. So these are all being adjudicated in the courts, but Trump did these in the regulations with the sole intent of undermining the ACA. The other thing that Trump did in the executive branch was allow states who didn't want to expand Medicaid because they didn't want to give Obama a victory, even though it was mostly federal dollars. And for the first 2 years, it was 100% federal dollars. No state FMAP, just all federal dollars. And this is what I did my dissertation on. Why did states say no? Well, they said no because they didn't want Obama to have a win. But some of the states really wanted to expand Medicaid, and the way they figured out to do it is they asked the Trump administration for a waiver of some of the rules. And what they said is, we will expand Medicaid to people who don't otherwise qualify, but we're going to require that they work. And they approved a number of states to do this. Now, advocates sued and said, you can't do this. Medicaid does not have a work requirement, and the ACA did not put a work requirement into expansion. So you cannot do this. It's beyond the scope of the executive branch. You can't make law with regulation. You can only implement law, and requiring work is a new policy. They've been suing all the way. It's supposed to be heard at the Supreme Court, and actually I'll get to that in a few minutes. It'll be heard by the Supreme Court any day now, but we'll get to it. The other thing that the executive branch could do is cut the money to implement inside the executive branch. They can shorten the time that you can go on healthcare.gov. Actually, the first year Trump was president, people could go to healthcare.gov to buy the subsidized health plans in the exchange only during November and December. And Trump's administration closed it for 2 weeks during that time for upkeep. They could have done it before November, but they waited till November. They made it hard for people to get into the ACA. They did this all within the law. They reduced the amount of money for advertisement. They lowered the amount of time that you could go online and enroll. They did everything they could through the executive branch to not implement the ACA. Okay, so we talked about how the Republicans tried to go through the legislative branch, but the elected officials didn't really want that responsibility. So they really did not do a repeal and replace, but they did manage to undermine the three-legged stool and the spiraling. Now we talked about what the regulatory branch did, and they actually did quite a bit, especially in this slide here. They cut the amount of money for healthcare.gov, so it didn't work very well. They allowed for Medicaid waivers to require work, and that made it hard for people to get help to Medicaid. And finally, they did pass those 3 regulations. So they did do things under Trump. Actually, outside of healthcare, Trump did so much to undermine the role of the government in every department through the regulatory process. It is scary things he did that we don't even know about. All right, there's another process, the judicial process. What can the Republicans do to stop ACA through the judicial process? Well, during Obama's time, they filed a number of lawsuits. The first one they filed on the day that the ACA was signed. 19 attorneys general from 19 Republican states, or 19 Republican attorneys general, filed suit and said ACA is unconstitutional. You cannot force someone to buy insurance. One of the legs of the mandate is unconstitutional. And that went to court. The question is it constitutional? And then somebody put it in, and this was not what anybody thought this lawsuit was about, but they also said, and you know what? The federal government, we have this thing in our country, one of the parts of the Constitution says that the federal government and the states are separate entities. We have a federalist government system, and the feds can't tell the states what to do. And therefore, requiring states to expand Medicaid is unconstitutional. The feds cannot do that. So this is what this lawsuit was about. Then there was another lawsuit, Hobby Lobby versus Sebelius. One of the things that happened is the ACA said preventative medicine, you have to provide preventative care. That's one of the essential benefits. But they didn't define essential benefits. So it went to the executive branch under Obama to define it. Secretary Sebelius was the Secretary of Health and Human Services, and under her, they defined preventive medicine to include contraceptives. No abortion, but all contraceptives. Hobby Lobby, which I didn't even know what it was until this lawsuit. For those of you who don't know, it's like Michael's. It's a huge craft show. It is privately owned by a small group of people, mostly one family. And this family is very Christian. And they sued Sebelius and said, you cannot require me, because they had more than 200 employees, you cannot require me, this company, the company sued, to require us to provide contraceptives. We don't believe in 2 contraceptives in particular, the IUD and Plan B, because those 2 contraceptives worked after, they argued, after conception, then that's when it happens, and they felt that conception is when life starts, and therefore it wasn't, you can't require a separation of church. Company, and they argue that they as a company have a religion, and therefore their religion doesn't believe in an IUD and Plan B. And the third lawsuit that was filed when Obama was still president was King versus Berwick. There was, because the bill was not very well, it was rushed, it was cleaned up. At the end, they didn't have time for cleanup. There were some messes in there. In the previous generations, when after a big piece of legislation passed, there would be a lot of cleanup legislation, but they couldn't do this in the ACA because the Senate no longer had 60 senators, it only had 59, and the Republicans would filibuster everything. So one of the messiness that came out of King versus Berwick was the sentence that said no subsidies for people who get health care established by the state. No, I'm sorry, that's not what it said. The law said there were subsidies for people who received health care established by the state. Meaning, some people argued that if the exchange was not set up by the state, but instead was set up the federal government, there were no subsidies. Now, everybody knew that this is not what was the intention of the law. Everybody knew, because they did some money, they did some modeling to see how much it would cost, and they planned on giving subsidies to every single state, to everybody under 400% of poverty, whether they were in an exchange established by the state or if they were in healthcare.gov, which is an exchange established by the federal government. Everybody knew that, but the law said that there were subsidies for people who purchased healthcare in an exchange established by the state. All three of these cases went to the Supreme Court. Well, let me just cut to the chase on what happened. The individual mandate was found to, yes, be constitutional. It was constitutional. And so the ACA, it was saved, the three-legged stool was saved. And the reason why they said it was constitutional is they said the penalty is a tax for those who do not have health care, and the federal government is allowed to tax its people. So the individual mandate survived the test of constitutionality. Now I want to repeat this because it's going to come up again. The individual mandate is constitutional because it is viewed as a tax, and the federal government is allowed to tax. That's going to come up later. But surprise to everybody, that the Supreme Court, in a 7-2 decision, this was not done on party lines. And by the way, this was a 6-3 position, the individual mandate. Chief Justice Roberts went with the more liberal people, saying that the individual mandate was in fact a tax. But they said, you can't force states to expand Medicaid. Everybody agreed, including Ginsburg wrote the case saying you cannot require states to expand Medicaid. This is too coercive. And we have a federalist constitution. And so Medicaid expansion was no longer required. It became voluntary. I'm going to presume you heard a little bit about that. I think I mentioned it in my talk, but I also in the ACA, Medicaid is voluntary, not because that's the way the law that was written, but because the Supreme Court decision said it's now it's unconstitutional to require a state. And not every state expanded. So we now have a group of people who are not originally eligible for Medicaid. For example, they're not women and children, but men who are very poor, under 138% of poverty, who cannot get Medicaid because their state did not expand. The Supreme Court agreed with Hobby Lobby and said you are not required to provide IUD or Plan B. The issue with this was not existential to the ACA. It was never going to kill the ACA, but the big issue with this is companies are now considered religious. And there are some issues that we don't even know is going to come out of this. King versus Berwick, they agreed that the intent of the law was all exchanges had subsidies, not just the ones established by the state. And therefore that would have been existential to the three-legged stool, because if there's no subsidies, that leg is gone. But this case, the Supreme Court saved the ACA. During Trump's administration, advocates sued the Trump administration about the Medicaid work requirements and the regulatory changes. and the Medicaid work requirements have been heard, are about to be heard like any day now by the Supreme Court, but the Supreme Court keeps delaying it. And part of the reason they're delaying it is the Biden administration canceled all the waivers and said they're no longer viable, and wrote a letter to the Supreme Court saying this is not an issue anymore. And so the question is, will the Supreme Court engage or not? And we don't know. There was also another lawsuit that came out, still trying to kill the ACA, that Texas, the state of Texas, sued Obama's government. But when it became Trump's government, Trump said, I agree with Texas. I'm not going to have the Department of Justice defend this case, which has never happened before. The president defends the law, regardless if he agrees with it or not, but Trump wouldn't listen to that. So Trump said, I'm not defending the law. And so California, Becerra got permission to be the defense. So the case got renamed Texas versus California, but it's really not California that Texas is suing. It's the California is representing all the other states that disagree with Texas. And this lawsuit is saying, because the subsidy is now zero and the ACA was found to be constitutional in NFIB versus Sebelius, because the tax was considered, because the penalty was considered a tax, and taxes are constitutional, but now the penalty is zero and therefore there's no tax, it's unconstitutional. And this case was heard by the Supreme Court, and we are waiting for the answer. Again, this is a question of the three-legged stool. If the penalty is not a tax, then there can be no penalty. Then is the three-legged stool going to stand? Well, it is standing, even though the penalty is zero. So it turns out that maybe we don't need a three-legged stool. Maybe only two legs are required, that people actually don't need to be mandated to buy insurance if there's a subsidy. And actually, I want to back up. Interesting enough, when Obama ran against Hillary Clinton, before he won the nomination, they had debates on healthcare reform. She argued for the three-legged stool, saying we need a mandate. We got to get rid of underwriting, and therefore we have to force healthy people in with a mandate, and we need to give subsidies. Obama actually argued against that and said, we don't need a mandate. If we get rid of underwriting and we have a subsidy, then people are going to come. We don't have to force them to come. They're going to get help buying it. They really want healthcare. They shouldn't be forced. In other words, if we build it, they will come. He was convinced by his policy people when he became president that, in fact, we do need a mandate. He agreed. In other words, he changed his policy from the debate and said, you're right, we do need a penalty. But actually, when they set the tax to zero in 2017, it turns out people didn't drop out of healthcare. They didn't care. The penalty wasn't forcing them to buy it. So maybe it really isn't a three-legged stool. It is maybe a two-legged stool, but we are waiting to hear from the Supreme Court. It will probably come out in June. And the question is, there's two questions, and these are big questions. The first one is it, if there's no tax, is it constitutional to require people to have insurance? No one cares about that anymore, because people are getting insurance even if it's required. But the question is, if it's considered unconstitutional, does the entire ACA go down in flames, including the Medicaid expansion, including up to 26-year-olds getting everything? The question before the Supreme Court is it severable? Can we just look at this part of the ACA and leave everything else? And we don't know. So the existential crisis of the ACA is about to be told in a couple months. I listened to the Supreme Court arguments, and it sounds like both Justice Kavanaugh and Roberts believe that the ACA is severable, meaning that even though the penalty is zero, and therefore the mandate is not constitutional, and therefore you can't have a mandate, doesn't mean the rest is unconstitutional. So most people believe that the Supreme Court is going to let the ACA stand, but get rid of the mandate. Now, Biden can change the penalty back from Biden, not Biden, but the Senate can change the penalty back from $0 to $1, $100, $695, which is what it was, or $10,000. And the question is, will this lawsuit go away? So we're caught between a change of administration. Most people don't think this is existential anymore because of the questions that the justices were asking when they heard the case, but we don't know what the justices are going to do. So these are both still pending. Let you catch up, take a drink. So this is what I just said. Now, so that's what the Republicans did legislatively. Mainly, they set the penalty to $0. They tried more, they couldn't do it. Regulatory, Trump did tons of regulations, but they're all being sued because the regulations were beyond the scope of the law. And judicially, a lot happened. But nothing that did kill the ACA. So, but states did different things too. Our what's happening in DC is nothing, because the filibuster doesn't allow things happen, and things weren't happening. So the states did things. So states did what they could. This deal, the Republican states tried to not implement things. They tried to create waivers that required work. They didn't help anybody get health care, but they didn't expand Medicaid. Democratic states tried to put in laws that buffered their state against what Trump was doing. So for example, they did expand Medicaid, and actually some red states did too. California even expanded Medicaid beyond to kids that are undocumented under 26. They put in their own individual mandates. There is a mandate in California that you have insurance, and if you don't pay your insurance, you don't have health insurance, you're going to have to pay taxes. You're going to have to pay a penalty. They also put in extra subsidies. States did what they could do to avoid letting Trump kill the ACA, because the ACA was the law of the land and it was getting people health care. They also, California put in required laws that said you can't have association health plans or short-term health plans in California. Okay. So I thought I had, okay, so we're moving into the Biden era, and Biden is trying to save the ACA. But does Biden have legislative powers? Can he, and what is the courts going to do? He does have executive branch powers. So he can stop all regulatory changes. So I can tell you right off the bat, it won't be existential what he does. And even if the legislation is trying to kill the ACA, it won't happen because Biden will veto it. Why not? Because he will veto it. And the Dems would control both houses. I don't know if you can hear the horn, I'm sorry, but they can lose either house. The Biden administration and all these things we're talking about in terms of the infrastructure changes and the voting rights and all the things that are happening, they are trying to do it immediately, because in 2022, there's another election. A third of the Senate is up for re-election, and the Dems may have, right now they have a majority in the Senate, only a 51, so they can't pass any laws because they don't have 60, but they can pass things through reconciliation. But they worry that they're going to lose even that little bit of that one vote that they have. Now, they may gain seats. We don't know, but they are worried that 2022, they could lose the House or the Senate. And typically in the midterm election, when the president is not up for re-election, typically the other party gets more power. It's mainly going to be status quo, because with a 50-50 Senate, they can't, unless they get 10 Republicans to pass a bill, it can only budget policy, which means it can only be about money, not about policy. So even though Biden ran for re-election on adding a public option and doing all these other things, he cannot add a public option unless he can get 60 votes, because a public option is not a budget issue, it is a policy issue. They could not do single payer. If Bernie had won and he had only 50 votes in the Senate, he couldn't do single payer, because you cannot do budget. You cannot do policy changes in our country as long as there's a filibuster. Now they're talking about getting rid of the filibuster. But in order to get rid of the filibuster, they need every single Democrat to vote to get rid of the filibuster. And Manchin, who is from West Virginia, which is a very conservative state, has said he will not get rid of the filibuster. But he has said he's willing to make the filibuster tighter. For example, you have to actually stand up and filibuster, and you have to talk about things that are germane, and it could be timed, I think. So there's other things they're willing to do. The House voted, a bill did just pass that did expand the ACA, by the way. The rescue plan for the COVID actually had some expansions in it. Through the reconciliation process, they made some expansions to the world of everything in our country. They did a lot of things to expand government and to get a lot of Biden's policies through, including expanding the subsidies, higher number, you can be richer. Instead of being under 400% of poverty to get a subsidy, they changed it to 600. And instead of then they also raised the amount of money that they got, but only for 2 years, and then the next election could change that. So the COVID recovery plan expanded subsidies, both the amount and people who qualified. It expanded COBRA, which I have not talked about. It's employer-based coverage. When you lose your job, you can keep your coverage, but you have to pay both the employer and the employee part. And it's been putting pressures on all the states that have not yet expanded Medicaid to do that. And they're doing that by giving them 3 years of, you expand Medicaid, we will pay, we, the federal government, for 3 years will pay everything. FMAP is 100%. So I've gone through this really quickly, but we will have a lot of time for questions. The ACA has survived during the Obama era, really difficult time becoming law. It almost didn't become law. Oh my God, I can't tell you how many times we thought it wasn't going to happen. It also survived Republican opposition that manifests in so many ways, through the courts, through legislation, through regulation. It survived 3 court cases: NFIV versus Sebelius, the Hobby Lobby, and King versus Burwell. Well, I said mainly 2, and I highlighted 2 because those 2 would have been existential to the ACA. They would have gotten rid of the 3-legged stool, which now we're finding may not be such a big deal. But at the time, we thought that if the 3-legged stool disappeared, the ACA would go away. The Hobby Lobby was not existential. It just meant that women who worked for Hobby Lobby or any other company that was not publicly traded, that didn't want to provide the IUD or Plan B, they couldn't get that and their own insurance. If you lived in Colorado, there was a rich guy who said, anybody who wants an IUD, I'll pay for it. So there were ways around it, family planning grants and so forth, but it said that basically big companies that were religious did not have to provide all kinds of contraceptive. The ACA also survived a number of elections. First, it survived Obama, it lost the midterm. The bill, ACA was signed in March 2010. In November 2010, the Democrats lost the House. In 2012, there was a presidential election, and had Mitt Romney won, he claimed he would get rid of the ACA. But Obama won, so that the Democrats got 4 more years to get the ACA to infiltrate the world and get people to get health care and people to like it, which is why the Republicans couldn't get rid of it when they owned this legislature, is because people liked it. And they were only able to get 4 more years because Obama won this election, which is why I'm saying that's the main election. The next midterm election in 2014, the Democrats lost the Senate, but they were able to keep the presidency, which meant that the ACA was going to survive. So that's what happened during the Obama administration. And Obama did not do anything in the regulatory process to get rid of it because he owned the regulatory process. And then during the Trump era, the ACA survived multiple attempts to repeal it during the summer of 2017. All 3 bills failed. But they also, during the Trump administration, did the yeoman's work in trying to get regulatory changes that would kill the ACA, or at least spiral it out by diluting the risk pool. And they tried to starve the ACA by reducing funding and everything that kept it going and letting it break down. They also tried to undermine the Medicaid expansion by not helping states expand it, by allowing states to expand it in a very weakened way, by allowing them to require work. And they made it harder to, in terms of getting help to get into the exchanges. They shortened the amount of time that you could go to the federal exchange. They reduced the number of people they hired to help. They really made it hard. And they really made it confusing. When they did pass the bill that made it so that the mandate wasn't there, the mandate was $0. A lot of people thought that the ACA was over and you didn't have to have health. People didn't know what was going on. And Trump did not try to clarify it. But it survived everything. Obamacare, it kept surviving. Now, under Biden, he promised to build upon the ACA. He promised to increase the public options. He promised to do some pharma controls and to allow for negotiations under Medicare. We know that a lot of these promises can't happen unless they get a stronger turnout in the Senate. They have to have 60 votes. They could get rid of the filibuster, but they don't even have enough votes to get rid of the filibuster because 2 Democratic senators, the one from Arizona and Manchin from West Virginia, said they don't want to get rid of the filibuster. But they did manage to do a lot already in a very short time. They managed through the American Rescue Plan, which was meant to help the states and people suffering from COVID problems. They put a lot of money into it through the reconciliation process. It was all money that built upon existing things. And so they did expand. They expanded ACA. So they allowed people to get higher subsidies by saying that you shouldn't have to pay more. They lowered the amount that you can pay for healthcare before the subsidies kicked in. They increased subsidies above 400% of poverty up to 600. They subsidized COBRA. They gave some unemployment money for people. If people earned 133% of poverty, they would have no payment. No payback. If they got extra subsidies afterwards, the next year, if you earned more than you thought and you got extra money, nowadays, before COVID, you had to return your money. Under the American Rescue Plan, you don't have to return the money. And they put in a lot of incentives to get new states to expand Medicaid, and new states are thinking about it. Even Texas has a bill to expand Medicaid. But at a minimum, Biden is not going to reduce the ACA. And today, in the news today, 2 things I wanted to highlight. Today, there was news that the private health insurance companies are expecting to pay $2.1 billion in rebates to consumers, the second highest ever, because they were collecting premiums and people weren't going to the doctor, so their medical loss ratio wasn't high enough. So they have to return premiums because they cannot earn too much in profits. Also today, Medicaid waiver that was approved by the federal government for Illinois was going to allow women to get Medicaid coverage while they're pregnant earlier for 1 year. Oh, I'm sorry, I'm saying it wrong. For a year after they give birth, even if because some states only do it, I think, for 3 months, and they expanded it a year. In other words, they're trying to expand coverage under Medicaid. So whether or not they have enough votes to make legislative changes and big changes to the ACA or healthcare in general, there are really ways that they can do it through regulatory processes. And I believe that is my end. I am going to stop sharing, and we have a lot of time for questions. But basically the gist is that the Republicans are trying to get rid of the ACA, and they tried it with the legislative process, the regulatory process, and the judicial process. And there were some close calls, but so far the ACA has survived. Questions?
Okay, so I hope this really painted a picture around how political all of these decisions really are. They're not as simple as this is what people need, this is what we're going to do, we're going to pass at the end. There's a lot of different factors that play in. And so when people call for your attention and advocacy as a medical student, a healthcare provider, a professional in healthcare. They're asking for you to be able to be the voice of patients in all of these political decisions. And so I hope you understand a bit more about the political levers that are necessary to pull in order to achieve anything in health policy and how rigorous of a process it is. If people have questions around this concept, just know that we're going to go a bit deeper into this as we move through the elective too. We'll talk about how the United States decides to make or decides to spend its money with a lecture of Tony Eiton tomorrow evening. We'll talk about how we got to this point in terms of the American Medical Association influencing some of these decisions. We'll talk about stakeholder analysis and what that means as a case study in the context of Medicaid expansion and how you can actually assess what levers to pull, knowing all these politics. So if people have questions, we welcome them. We did finish a bit early tonight. I should also mention that feedback is open for this session, and we want to make sure that we gather some good feedback about this section. I'll drop the link to it in the chat. But any questions about all of these politics? Was anyone surprised by this? I hope someone learned something new about what's going on behind the scenes. Okay, an awesome question from one of our students at UC Irvine. If the ACA continues to prevail, but the Dems lose the Senate in 2022, remember to vote in your midterms, is it likely that it'll still survive? Is there any hope that we'll move toward less partisanship in healthcare reform?
So if they lose the Senate in 22, they still have the White House. So Biden will veto. So they're not going to lose the ACA. They just won't build upon it. So in terms of really being fatalistic, to a fatal wound, it would be not having Biden or whoever. If it's not Biden, Harris, whoever. If the Democrats don't win in 3 years, then there's another risk. But as long as Biden is president, the ACA, at least through the legislative process and the regulatory process, it's not the demise. It's just not the growth he promised. There's still judicial chances. There is the lawsuit that we're still waiting to hear the results. The question is, first of all, will the Supreme Court hear the Medicaid case? And no one knows. They keep pushing it out. So the thinking is they probably won't. But they already heard the case on the Texas case about the taxes. And the real question isn't, is the tax constitutional or not? Because the tax hasn't been in place for 2 years and the ACA hasn't collapsed. And in fact, the ACA has only gotten stronger. And with COVID, more and more and more people went into the ACA. So it's only stronger. So it turns out you don't need a mandate to make people to go in, that they do want the subsidy. So that we think they're going to say that it's not constitutional to have a mandate, but no one cares. The question is, if it's not severable, meaning that that part's not constitutional, nothing in the law is allowed, then we have the end of the ACA. Can you hear me?
Yeah, we can.
Okay, you just froze on me. I don't know if it was you or me. So in June, we will find out if the Supreme Court says that the mandate is not constitutional and therefore the entire ACA is garbage. We have a problem. No one believes they're going to say that, but we don't know. So that's a bigger issue than losing the Senate in 2022 with regards to the ACA surviving. Every year, I mean, I wrote a couple papers about this years ago, but the fact is the ACA has already been around for 11 years. It'll be 11 years in March. They're not, I mean, the Supreme Court could say that it's not legal, and that's going to be fascinating, but I don't think the Republicans are going to ever vote to get rid of it through the legislative process. They don't want that responsibility. They already showed us they don't want that responsibility. They didn't pass a repeal in 2017. So, the main thing is vote, and get other people out to vote. And the main thing now is HR1. If they get rid of the filibuster and pass HR1, and so voters' rights are protected and they're not cutting out votes, then their likelihood is they won't lose the Senate, but you never know. So I'm not sure if I answered the whole question. I think there were 2 parts, but I'm not sure if I got both parts.
And I think this question is actually really interesting now that you framed that how a legislator might speak on the campaign trail or even vote in Congress might be different than what the actual effect of said actions are. So the second question that was asked is there any hope that will move towards less partisanship in healthcare reform? And that's kind of dependent on, I think you have to ask the specific question, less partisanship in how legislators present themselves, or less partisanship in what we actually decide to pass, but vote upon, et cetera, in Congress, right? Like, because you've outlined that those are two different things, but
Yeah,
largely, what do you think?
I often think that if votes were secret, so many things would happen differently because what they really like in terms of policy is not always what they vote on. I don't see less partisanship in anything that costs money from the government. So long, I mean, voter rights movement can change things because it depends if more people are able to vote. The public is not as divided as voters are divided. Polls have shown that people who don't vote tend towards Democrat. That doesn't mean that everybody who doesn't vote's a Democrat. In fact, there's a good percentage that are not. But partisanship is not just about healthcare. It's about the role of government in general and the role of taxes. And there are people who are anti-taxes. I think as our country becomes more diverse is really what's going to change things. I think that I'm not equipped to completely talk about this, but I think race plays into all of this. And the issue of race and the Republican Party, which typically, has not been a party of diversity, but as everything becomes more diverse, maybe we'll have less. I don't know, but I think partisanship is here to stay for the long while because it's really about. I have a brother who is a libertarian who doesn't want to pay taxes for them, and I think them is people of color. But in his case, he says it's people who are lazy, who don't work. Why should I work so hard? Now, my brother named his first child Atlas after Atlas Shrugged, but he's very educated. He went to Yale. This is no dummy. There are people who just disagree with the bubble that I live in and teach at Berkeley. And our country's pretty equally divided. And it's not just about healthcare. It is about the role of government, which means taxes, and whether or not my tax dollars should cover those people. However you want to define those people. I personally think race is a huge part of it. But even if race isn't a part of it, my brother says the lazy people. People who don't earn as much. It's not their fault that, it's not my fault they're not as smart, whatever. So I don't think it's just healthcare that's partisan. It's everything. The role, actually, what's really showing interesting right now is what's going on in Georgia and the role of corporations and what corporations are saying about the voter rights. And, Coca-Cola and Delta Airlines were silent when the bill passed. And then after the bill passed, they started speaking up, which was a little bit, they were a little bit chicken. They didn't take a position beforehand, but businesses are really are getting involved, and they used to always align with Republicans. And that's not the case anymore. So I think that's what might make things a little less partisan when Republicans don't just have, when money is going everywhere. Biden really won the election by quite a bit. Now that was Trump. Who knows if they had a more moderate Republican, but I don't think these debates are going away.
If anything, they might get even more charged.
Yeah, but it's not just
about the trajectory you've been on, right? We have been deeply provided, but it's also interesting to think about how some of our interests are a lot more liberal now. Liberal, and when I say interests, I mean in healthcare, namely the AMA. In the entire debate around insurance, the AMA has been a staunch opponent of progress. And now you see an AMA that is a staunch proponent for the most part. I think there's a lot to be said about the role of interest too.
Well, I actually want to say something about this because you are an audience that should be hearing this. I worked for the CMA and I went to many, 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 many AMA meetings across the country. And I will tell you, I have never seen a more democratic organization. You have a policy recommendation, they will vote upon it. Get involved. Now, let me tell you, the reason why they've been so conservative is they used to be old white men, basically, in part because the AMA didn't let anybody else in for however many decades, but also because the people who put time and energy into making these policies are people who are usually older and retired. And it used to be that was white men because that's who went to medical school. But as the world of medicine gets more diverse, both in terms of people's backgrounds and in terms of politics and in terms of gender and in terms of everything else, AMA and the CMA and your county associations are changing because you are them. So you want to get involved in policy and you don't like what the AMA is doing. And I don't work for them anymore, but I was so frustrated because I had so many friends who were physicians who hated the AMA and hated the CMA and didn't think they spoke for them. And I said, you guys, if you only paid dues and said something, can I tell you, I work for the CMA. They were one vote short at the board of being supporters of the single payer. It is the most, to a problem as a worker bee at the CMA, it is the most democratic organization. And so one silly, crazy person could get 3 hours of debate if they get the floor, and everybody's allowed to debate and vote. And so if you guys want medicine to go a certain way as future physicians, get involved in organized medicine. First of all, it's fascinating. Secondly, you can make a difference and you can take it away from those old white conservative men that said no to everything.
Yep. And on that note, we'll have a session really dedicated to how the profession has changed over time in the context of the AMA, going back to it, starting at its roots and its founding principles, where it held its first meetings, through what it looks like now. And so I encourage you all to join that lecture with Doug Haynes. We're also going to be talking about organized medicine. We have an entire panel of different physicians who have been involved in organized medicine in different arenas. And so if you want to understand more about what that is, come to our panel. That's on the 22nd. And we're featuring a lot of different physicians in different stages of training. We welcome any other questions, but it looks like we are coming close to our time. So by all means, drop them. We'll be here for the next 3 minutes, and the survey feedback will also be open for the next 3 minutes. So we do have a couple folks singing your praises in the chat, both to direct message to me and publicly. So I want to echo those sentiments and thank you, Dr. Flagg, for being such an awesome supporter of this elective initiative and bringing a really necessary context to all that was introduced earlier today. For those who are sticking with us throughout the elective, we start back tomorrow, the same link at 1 p.m. Pacific. Thank you so much for being here.
Bye.